In our community, accessing health care is a major challenge for many people due to barriers of geography, windy mountain roads, and also a lack of healthcare providers. By providing healthcare services to kids in schools, parents don't need to feel pulled between working to provide for their families and taking their kid to the doctor for a cold, an earache, or a strange rash.
The parent signs permission ahead of time at the beginning of the school year in the permission packet. No child can be seen without parental consent. I will call the parent and say, you know, we're going to see your child today. Would you like to come in and be a part of this and talk to the nurse practitioner?
Nurse practitioners are able to diagnose and treat the majority of illnesses that a family physician or a pediatrician would see. My Healthy Schools operates just like a regular doctor's office as far as making an appointment and billing for services. A parent can call and ask us to see Johnny for an earache or a sports physical. Johnny can come down and see us and we'll bill his insurance. For kids who do not have health insurance, we will see those kids without any charge to the family.
I feel the telemedicine program supports both the students and myself in two major ways. The first is the students who are my patients are able to be seen, triaged, and have their problems addressed in the school setting, allowing that child to stay in school if at all possible. For me personally, patients are no longer banging down the door at 4 o'clock when they've gotten out of school, trying to get those last-minute walk-in appointments. And I'm not feeling as bombarded with strep throat checks, coughs, all of those simple things that could easily be done in the school setting and are being done in the school setting thanks to telemedicine.
Remember that whatever I can see on the screen, so can Amanda, and you can too, okay?
Both the nurse practitioner and Yvonne were wonderful. The quality of care was phenomenal. Liam trusted Yvonne and I felt very confident in their decisions with what was going on. I was also thankful that I didn't have to take him to the doctor's office where the flu was going around or, any kind of illnesses that he would be susceptible to.
It's a very useful way to, again, prevent a kid from missing a day of school for an easy, quick 15-minute follow-up, such as an asthma exacerbation, a sprained ankle, strep throat. All of those are good conditions which may require somebody to lay eyes on them another couple days. And again, it doesn't have to be me. I don't feel threatened by telemedicine seeing my patients because I know in the end I'm still their medical home.
We are not here to replace 10 or 15 years of relationships. One of the ways that we can do this is by taking pictures of infected ears or of a rash and sending them electronically to the primary care physician along with a copy of the encounter note. School-based health centers have been demonstrated to improve attendance, increase graduation rates of at-risk students, result in improved care of chronic illnesses like asthma and diabetes, and also reduce students' dependence on the emergency room for non-emergent healthcare issues. 75% of the visits to the emergency room could have been better served at a regular doctor's office or through our school-based telemedicine network.
Whether they don't have insurance or their parents, they work at odd hours, they can't get them to the doctor, telemedicine has worked great at decreasing the number of those children going to the emergency room.
We know that attendance is a major contributing factor into success of students. So we're fortunate that our students can visit with a doctor on a daily basis if they need to here at our school.
In addition, School-Based Health Center offers behavioral health services, allowing kids to talk to a counselor about their weight, being bullied in school, or the death of a grandparent. School-based health centers are a way to provide comprehensive care focused on children and adolescents, where kids spend the majority of their days. We believe that having healthier kids results in a healthier community and also better academic outcomes.